Oleg Banakh, sir, thank you for coming on today. Super happy to have you on. We've had multiple people come up to me, actually, personally. I'm sorry, I'm trying to catch my breath. Come up to me and say, hey, Ruslan, can you please interview a nurse? I'm trying to be a nurse, and I honestly thought the nursing phase has passed us, especially the Slavic community, but it definitely hasn't. Kids growing up still want to become nurses. Some of them, from what I know, want to become nurses because they love it. They love helping out. They just love the medical field. They love the guts and the glory, I guess, if I could say it that way. Other people, unfortunately, are telling me they just want to do it for the money, which I'd rather not hire them. And you could speak a little bit on that. But Oleg, you have been a nurse for how long now?
Well, first of all, thank you for having me.
Okay.
I know I've been trying to get on for a little while, but my schedule's been a little bit hectic. So
a nursing
not
schedule.
until today.
A nursing schedule sucks, or what are we saying?
No, I mean,
Let's talk about the nursing schedule.
okay. So most of the people, they work either 12 or 8 or 12-hour shifts, right?
Okay.
My schedule is 0.8, so it's 64 hours in 2 weeks. But just the way my schedule worked out is that I just completed my 9th shift in a row. So I am very excited to have this weekend off. So finally, I'm able to catch up with you a little bit.
So are you coming here from work, or did you get some rest?
No, I had a couple days off.
Oh,
so,
okay. Okay, good,
yeah.
good.
So now I'm off till Tuesday. So yeah, I have a little break coming up.
Okay, awesome. You've been a nurse. Talk a little bit about yourself, your background, and then maybe how long you've been a nurse, what unit you work in, and
Sure.
we can go into specifics from there.
So I started off, I thought I was going to be a firefighter.
Okay.
So that was my first career choice that I went into. I actually went through the Metro Fire Academy. And when I graduated, I kind of started to look at life a little bit more realistically.
Mhm.
I was like, what are my chances of getting a job as a firefighter?
Mhm.
And so knowing that some of my classmates, well, now learning that some of my classmates had to wait for over 5 years just to have a chance for an interview as a firefighter,
Wow.
I was like, this is not something that that I can do.
It's not sustainable.
It's not, because I need to provide for my family. I need to support my family. I need to make a living. And so what is another career that I can choose that's also helping people
Mm-hmm.
and that I can go into school, get a degree, and able to get a job. So in 2012, I got into nursing school.
Okay.
Well, first of all, I was taking my prerequisites, then I got into nursing school in Delta College, and I can talk about that later if you want.
Yeah.
So I got into nursing school in 2012. I got hired as a CNA at one of the Sutter facilities.
Okay. I'm gonna pretend I have no idea. What is a CNA?
So CNA is a certified nursing assistant.
Okay, so it's not a nurse.
It's not a nurse. It's kind of, you can get a certificate to be a CNA from like ROP or like a 1 semester of college classes and stuff like that.
So that's more of a certificate rather than a degree or a license?
Yeah, it's not a license, it's a certificate. So certified nursing assistant.
Okay.
So pretty much you're working with a nurse and you're helping with everything they need help with, accept medications, accept assessments. You don't communicate to the doctor specifically. So you pretty much taking direction from the nurse.
Okay.
So certified nursing assistant. So one of the ways I know that getting into the hospital was, at that moment, was pretty difficult.
Mhm.
So getting in as a CNA was my pathway to get into a hospital system.
Okay.
I know some people start off in a nursing home. Some people started off doing different ROP and different maybe technical classes.
What is ROP?
ROP is something that you can take when you're still in high school.
Okay.
It's kind of like a program that it is sponsored by high school. That way you can get some on-the-job training.
Awesome. That's cool.
It's more of an exposure and just to see and figure it out if this is something that you want to do for a living or not.
Okay.
And so...
And if you don't have ROP in high school, this is the podcast that we've been talking about. I'm just going to put that out there.
Yeah. So in 2012, I got hired on as a certified nursing assistant, and that's when I started my nursing school.
Okay.
So that was kind of my way into the hospital system. So I worked as a CNA for 2 years,
Mm-hmm.
finished my nursing school
In the hospital?
in the hospital.
Okay.
Yeah.
What hospital did
It was
you?
Sutter Faith.
Okay.
Yeah, it was a little hospital, and that's where I got my most of
That's
it.
crazy because I don't really hear of CNAs that often anymore. I mean, did they stop hiring them? Is there no need for CNAs anymore?
No, there is.
There is.
Yeah. I think a lot of hospitals they kind of go away with it. I
Mm-hmm.
think Kaiser they don't have CNAs; they have more of a techs.
Okay.
And I believe UC Davis, they're also kind of phasing out a little bit of that. And so they also have techs.
Okay.
Sutter, they still hire CNAs. So that's still pretty active. And I know CNAs, they're really active in a skilled nursing facilities.
Mm-hmm. Okay.
So they have them over there.
Okay.
And so when I finished nursing school, I got hired on telemetry unit,
Mhm.
which is kind of like cardiac unit where
Okay.
people who have heart conditions and stuff like that.
Mm-hmm.
So I got hired on in 2014.
Mm-hmm.
And yeah, and Sutter Faith is a great hospital. It's just very little hospital. So I didn't really get a lot of exposure to different procedures, there wasn't much room to grow. So that's when I transferred over to Sutter Roseville.
Okay.
And since 2014, I've been at Sutter Roseville ever since.
And I know Sutter Roseville is more specific with like cardiac.
Not just cardiac.
What unit do you work in?
So I work in med surge. It's called
Med Surg.
med surge. It's
Okay.
a medical unit.
Okay.
It's kind of like a med surge. It's like a medical slash surgical.
Mm-hmm.
So we are a sister unit with the surgical department. So we deal with a lot of pre-op, like a lot of patients going to surgery before they go into surgery,
Mm-hmm.
and a lot of patients who are coming from surgery.
Okay.
So it's a pre-procedural and kind of like post-procedural.
Okay.
We also deal with
So the people there are always like drugged up. Is that correct?
they can be when they come in out of surgery because they're still under the anesthesia effect.
Okay.
So yeah.
Okay.
So yeah, med surg is also it's a lot of surgical,
Mhm.
hips, knees, abdominal surgeries.
Okay.
Nothing really that complicated like a heart, open heart, and stuff like that.
Okay, gotcha.
So that's more of a like ICU and critical care. But we also deal with a lot of infections, a lot of people who have minor heart issues, a lot of people who have respiratory problems, a lot of people who have blood sugar, diabetics, a lot of people who have different wounds.
Okay.
So med surg is kind of like a unit that you're exposed to like everything, but a little bit of everything.
Okay.
So that's the beauty of working for that unit.
So you said you started with telemetry, and we actually had a nurse on that now works in telemetry. So if whoever's listening or watching, if you guys are interested, you could watch the episode with Lily. But how do you like? Can you compare telemetry to MedSearch now? What do you like better about what you do now? And a second question would be, say I'm a brand new nurse, do I have the choice of, okay, I want to work in this unit or I want to work in this unit, or because you're a newbie, you kind of just take what you get?
It's kind of both.
Okay.
To answer your first question, a telemetry unit is more specific for the people who needs their heart monitored
Okay.
like all the time. So they have something called leads. So that's something when you see on the computer, it shows the EKG, it shows the waves to see how the heart is doing. So those are the people who have potential of going more south health wise.
Okay.
So it just helps us to keep closer eye to see how they're doing pretty much with their heart. Our unit, they're not monitored, so it's pretty much a little bit less risk patients.
Okay.
Sometimes when a doctor feels like the patient needs to have specific drips, special maybe heart medication drips that have to be very, very specific because at any time the heart can react a different way. So they need to be on that telemetry unit so we can watch closer to see how they're doing.
Okay. So then MedSurge, that MedSurge would be not so specific to the heart or watching the heart.
Correct.
When you said leads, I'm gonna ask you, what the heck is a lead?
Yeah. So your heart. So let's say you have a heart, right?
Yeah.
And so there's different chambers to the heart.
Yeah.
So leads are pretty much they're these kind of like a stickers. So
Oh, okay.
you have a stickers.
Yeah.
Pretty much a couple of places on your body.
Yeah.
And they have these wires that are attached to it.
Okay.
And usually they're connected to a little box, which it's like a receiver that shows what it reads, to see how your heart is beating, shows your heart rate, shows the rhythm, to see how your heart is reacting to anything, and it shows it on a screen.
Okay.
So the nurse is able to look at the screen later on and to see and be able to interpret to see if your heart is in any distress or the heart is beating well, and pretty much just to monitor what the condition is.
Okay. Okay. So we just learned a little bit about kind of what you do in your unit. I guess that's pretty cool because you're kind of exposed to a variety of different things. So I guess you gain very good knowledge and experience. What is your day? What does your typical day look like? You come in. I mean, how does it start to end a little bit?
Yeah, so I work night shift.
Okay.
So I have
You
yeah, I mean, well, I like it. I chose actually.
really?
When I was going to Sac State for my bachelor's, and I'm pretty sure we're gonna get to that later, but I kind of had no choice because I was working my full time on nights, and then as soon as my shift ended, I went to Sac State because I had a class like 9 o'clock that morning. So working night shift was the only option I had at that moment. But I fell in love with it so much that ever since graduating from Sac State,
Hold
I just
up, you
stuck
just
with
said
it.
you fell in love with working nights?
I did. Because see, the thing is
That's-
with nights
yeah.
is that you don't have a physician right on the unit and kind of like to babysit you sort of thing. You don't have a physician right there that you can just reach out and just ask about anything. So you have more of a autonomy. You have more of a kind of like you get to use more of your judgment to see how well your patient is doing, to see if it's anything critical. You always have an option to call down because we have a ED hospitalist. So those are the hospitalists that get patient admitted when patient comes into the hospital. So, but we don't always call them about every single little thing. This is where we kind of use a judgment to see if this is something that's urgent or this is something that can wait until the morning and when the day shift hospitalists can address those issues. So this is something that I like. I also like the fact that you don't have a lot of people. You don't have a speech therapy. You don't have a social work. You don't have physical therapy. You don't have all these multidisciplinary people walking
Stealing your
around the
time.
unit. Exactly.
Okay.
And you have more opportunity to spend the time with a patient. Maybe you need to educate them about something. Maybe you just got to sit and listen to them, what they got to say, because a lot of times all the patient wants to do is just talk.
Yeah.
And sometimes, you just ask them a simple question, how was your day? And they just started going all but their life story.
Okay.
And a lot of times you don't need to do anything. All you got to do is just listen. And so that's what I like about night shift. I mean, night shift is difficult in its own way because this is where we get a lot of admissions to the hospital as well.
Yeah.
Because a lot of people, apparently, they like to come to the hospital when there's evening or nighttime, not daytime. So
Well, at daytime, you still got lunch and dinner. I mean, you're
Yeah.
not going to skip out, you come in at night, you get your rest, they take care of you. You probably don't even, you don't have to take care for yourself. So it's easier. Okay. So you come in at night. I mean, what does it look like when you're taking over from the other nurse and all that other stuff?
So when you walk in, the first thing you do is you get a report.
Okay.
For the last 5 years, I always get to work maybe like 45 to 50 minutes early. That's just my personal thing. I like to come into the floor, just kind of get a feel for the unit to see what the aura is, what the environment is, to see how many open beds we have, how many admits I'm expecting, just to kind of get a feel for it sort of thing.
Prepare yourself.
Kind of like prepare yourself mentally. So then when it's time to clock in, then you get a report. You get a report from outgoing nurse. So during pretty much with the report, the nurse would tell you what's going on with the patient, who the patient is, what's going on, what we're doing about it, what is the plan, and if there's anything else that needs to be brought up.
Okay.
As soon as you get a report for all your patients, in California, we have in a hospital system, it's a 5-to-1 ratio. So you get an acute care facility, you have 5 patients for 1 nurse.
Okay.
So as soon as you get a report, you prioritize to see out of your 5 patients who needs to be seen first and what needs to happen first. So then you go and see your patients right away. See your most critical patient. You got to put your eyes on them, make sure they're doing okay, make sure they're stable before you get a chance to see all your other patients.
Okay.
So you get a report, you go see your patients, you assess your patients, give them any medications, give them antibiotics. Especially at night, there's not many surgeries going on at night, so we do a lot of prep work.
Okay.
If the patient's going to surgery in the morning, we do a lot of prep work in regards to paperwork, make sure there's a consent sign. Consent just pretty much means it's a legal paperwork that says what procedure the patient's going to have and if the patient's okay with it or
Okay.
not. A lot of times we do preparation like blood transfusions. If the patient needs to have their labs drawn, we make sure that happens. If there's any prep work for any stomach surgery and stuff like that, we make sure that happens.
Mm-hmm.
So we do a lot of prep work.
Okay. So like maybe give the patient certain fluids that they
Sure.
need before, or you guys don't do the anesthesia part. That's somebody else, correct?
Anesthesia is it's either CRNA who does it or anesthesiologist, and that
Okay.
happens usually in pre-op.
Okay, gotcha.
So nurses don't deal with that
Okay.
much unless you are a CRNA, and that's extensive training for a nurse as well. So that's
so CRNA stands for.
I think it's certified registered nurse anesthesiologist.
Okay.
Yeah.
So it's just a nurse with extra things attached to their license.
Yeah,
or
I
whatever.
think you have to be a master's degree trained,
Okay.
and I think you have to have certain amount of hours that you spend in OR as a kind of like preceptorship.
Okay.
Yeah, but that's extensive training. Yeah, I gotta go to.
Okay.
So that's pretty much for the night shift. You give medications. You always have to monitor the patients, make sure how well they're doing. If you feel like the patient's not doing well, you have to communicate that to the doctor to see what we can do about that. Use a lot of critical thinking to see what you need to call the doctor. What there's something that you need to implement yourself. One of the beautiful things about working for the hospital that I work with is that we have something called a rapid response team. So if at any point we feel like the patient is just about to crash or is not doing well, we can call the rapid response team. And that rapid response team is a combination of respiratory therapist. We have a nursing supervisor. We have an ICU nurse, one or two ICU nurses. And you have that resource as your backup.
So are they always on the floor ready to go, or?
There's always that team that's available for the whole hospital.
Okay.
Yeah.
Okay, that's nice. So you get a break? What are your breaks like as a nurse? I mean, obviously nights can be busy, nights can be not busy. Same with days can be busy. Days sometimes aren't as busy, but usually they probably are more busy than nights. What's your break system like? Just as like I get a job, what am I expecting?
For 8-hour shift, you get a 30-minute break for your lunch, and you get two 15-minute breaks.
Okay.
Yeah. So we have a resource nurse that usually just provides the breaks for you. They help out with different things, whatever you need help with. But main responsibility is providing the breaks. And while you're on the break, if you need antibiotic to be hung or there's something that you want to delegate to them that they can do for you, they're able to do that as well. Okay. So usually 30-minute and 2 15s that you're given.
Okay. Any like specific stories, maybe examples that stand out that you would want to share, just from your experience?
Can't think of any specific story. Okay. I mean, I think the thing is with nursing is that there's no 2 days are alike.
Okay.
Every single day, even though you might have the same exact patients, that none of them went home, none of them got discharged, but the situation just changes. Either their health deteriorates or they get better, or something else changes. No 2 days are ever the same. Changing. Things are always the same, and things are always changing. Yeah. Okay. Things are always not the same.
Okay.
So there's not really one story that comes to mind because every single day is a unique day and every single day brings its own challenges.
Okay.
Yeah.
Okay, awesome. So that's a little bit of the what. I can't see, I'm not really looking to be a nurse, so I can't think of any other specific questions. Let's move to the why. Why did you decide you wanted to be a nurse? Is it something, and actually this is a question we got on Instagram from one of our followers. She said, I asked the nurses that you interview, is this something they knew they wanted to be? Like, what were they doing before they decided to be a nurse? Like you stated, you wanted to be a firefighter. You ended up going to nursing. You saying you love your job. So I'm guessing maybe some people are thinking like, well, I haven't been on a medical path my entire life or these previous few years. Do I really love nursing? You know what I'm saying? What would you say to that?
I think they should definitely challenge themselves. Nursing is a career. It's a career that if you're looking to be challenged,
Mm-hmm.
if you want to really optimize your mind to like literally 100% potential, because this is a career that it's a lifelong learning.
Mm-hmm.
I know the podcast you had before, you had Rachel on.
Mm-hmm.
So she shared some of the things that they do with the medications, how they produce them and stuff like that.
Mm-hmm.
So there's always something new that comes out.
Yeah.
So especially if you're in medical field, you have to be prepared to always learn. There's always a new medication that comes out.
Yeah.
You always got to stay on top of it as well. But for me personally, going back to your first question, I knew always I was going to be in medical field no matter what.
Okay.
It's just
How did that happen?
I think it is personality driven.
Mm-hmm.
I think a lot of nurses are like type A personality.
Mm-hmm.
There's like, first of all, they know they are leaders. There are specific people for this kind of job. And for me, for a lot of people who know me and personally and maybe
Yeah,
my
yeah.
family, they know I lost my mom to lung cancer.
Mm.
And my aunt also passed away from lung cancer. My grandpa had a colon cancer, and he's actually doing really, really well.
Oh wow.
So a lot of my family have been affected
Mhm.
by these horrible diseases.
Mm-hmm.
And so I'm growing up, I was never a stranger to hospital systems. So I spent a lot of time in a hospital.
Okay.
So being able to see what they do
Mm-hmm.
is touching, because you look at yourself, it's like, what other career can I go into where I can help people,
Mm-hmm.
potentially be that little piece of a puzzle
Mm-hmm.
to help them make their life better,
Mm-hmm.
and actually do that for a living. When you
Awesome.
go to
Yeah.
the hospital, it's like, who's the first person you talk to? You don't talk to the doctor, because you see the doctor maybe for a few minutes here and there,
Mm-hmm.
but most of the time you just see a nurse.
Yeah.
The nurse is there for 8 hours, 12 hours. And for me, the deciding factor was that I want to be part of that puzzle. I want to be that piece.
Mm-hmm.
I mean, of course, when it comes to a patient's well-being, it's never one person. It's such a multidisciplinary team, because
Mhm.
doctors play a crucial role. So they diagnose a problem,
Mhm.
and nurses pretty much carry out the orders.
Mm-hmm.
Then there's physical therapy. There's a speech therapy, especially they're so important, especially for people who have strokes, people
Mhm.
who can't swallow after a certain disease or
Mhm.
after a certain procedure. There's physical therapists who help them walk after surgeries, get them back into the shape. Pretty much the goal is to get them back into the environment so
Mhm.
they can live their life how they used to, as much as they possibly can.
Got you. So that's actually an interesting story, because I usually in the medical field, for some reason, that's kind of how I've noticed it runs, is either your family member was in the medical field, or growing up, you, like you said, you spent a lot of time in the hospital, and this kind of, you're saying it was something, I don't want to say dear to you, but you were used to it, something, and it's something you fell in love with, and you saw that you can change people's lives. What would you say to somebody that's saying, so I don't know if I love nursing, but I know nurses get paid a lot of money. I want to be a nurse. Are they going to love their job? I mean, have you met any nurses that way? What do they say?
Yeah, especially going through nursing school. Nursing school was challenging on its own.
Mm-hmm.
And what makes it even harder is that what kind of professor you get to teach you, right?
Mm-hmm.
So some of the professors, they want you to succeed, and they truly, truly invest all of their time in you. They want you to do better. They want you to learn. They want you to practice, and they want you to be a good nurse when you graduate.
Mm-hmm.
Some professors, they're not, you can tell their heart is not really into it.
Mm-hmm.
And in that return, a lot of students suffer, because a lot of students either drop out or because they realize that nursing is not what they thought it was going to be. And that pretty much just damages the nursing students.
Yeah.
For the people who actually thinking it's for the benefits or for the financial point of view or anything like that, I'd say just run away as far as possible. I mean,
you heard it from a nurse. I'm not going to tell you guys anything else.
if you're not in there because you actually want to help people, it's a wrong path for you. Just because the thing is, nursing, you gotta be very adaptable. That's A.
Mm-hmm.
You come into a shift, you get you set of 5 patients.
Mm-hmm.
You don't know what kind of patients you get.
Mm-hmm.
It's the way you talk to your patients.
Mm-hmm.
You're not gonna talk to an 89-year-old confused lady
Mm-hmm.
the way you talk to a 20-year-old gal who's
Mm-hmm.
coming off meth.
Yeah.
Its approach is very, very different. But yet, you have to provide that compassionate care. You still got to provide the humble presence. You still got to
gotta
make
love
them
them
feel
genuinely.
safe. You still
Yeah.
got to make them feel safe, because you got to realize when patients come into the hospital, first and foremost, they feel vulnerable. A lot of them, they've never been to the hospital. They don't know what it's like. They don't know what to expect. They're scared. So what are you going to do to help the situation? If you're there for anything else except to do something better for the patient and their care, they're going to feel it. The patient's going to feel it, because you're in the room 20 times in and out, in and out. The patient is actually in the bed for those 8, 10 plus hours. So all they do is just lay, maybe stare at the TV, stare at the wall. So when you walk in, they can sense it. They can sense what you're saying. They can sense your body language,
Right.
how you're going to talk to them. They can sense if you're having a good day. They can sense if you bring in your baggage from home. If you had a bad day at home, you come in and
your kid spilt a bunch of beans on you and you're pissed.
it's going to show. And
Yeah.
and the thing is, the worst part about that is your patients are the ones who get to suffer. So if
That's true.
Yeah, if you're anything then patient care, maybe taking care of these patients who actually need help, this is not something for you. There's a lot of different careers. If you're looking for money, if you're looking for benefits, choose something else.
If you're looking for
go
money,
and run away.
There's a bunch of realty and quick schemes, quick get rich quick schemes. Maybe those
Flip houses, whatever you got to do.
All those commercials. Go make money somewhere else,
Yeah.
right? That's true, man. I have to agree with you because I've spent some time in the hospital, and you can definitely tell when a nurse comes in and she wants to or he wants to be there, and the nurse loves taking care of people. You can feel it when the nurse comes in, the way the nurse talks to you, when the nurse leaves, asks you, hey, next time I come back, can I bring you anything? Do you need anything? And I agree with you 100%. So if you guys are going into nursing for the money, do not go to nursing. I don't want you to help me in the hospital. I'm just gonna put it out there because it's you have to love it. You have to love working with people, and that makes all the difference. Sometimes and I know you know this. Sometimes a disease is something more mental, and just if you give people some attention, some love, some care, that makes their pain go from 9 out of 10 to 2 out of 10, maybe, and so that definitely is a part of the healing process, the love and the compassion from a nurse. Moving to the how can I. So another question we had before, and then we'll go into your schooling, kind of your experience, all that stuff. Just straight to the question. We had a question. They asked, what is the hardest part of nursing school? So someone's looking into getting nursing school and they're trying to prepare themselves mentally, probably. What was the hardest part for you in nursing school?
Getting into
Nursing school. Wow.
There's a lot of people interested in this career.
Mm-hmm.
So starting out, I applied as soon as I finished my prerequisites, right?
Mm-hmm.
So pretty much the start is that you go to college. I started with community college.
Mm-hmm.
You can go straight to Sac State. You can go to any state university right away. I started with community college.
Mm-hmm.
For one, is that the classes are cheaper, much cheaper. It's easier to get in.
Mm-hmm.
So once you do your prerequisites, your anatomy, physiology, psychology, nutrition, chemistry, all of those fun stuff.
Mm-hmm.
Once you finish your prerequisites, you apply to nursing school. And that is the most challenging part. There's a couple of schools in Sacramento County.
Mm-hmm.
There's American River College, there's Sierra College, there's Sacramento City College, and there's Sac State.
Mm-hmm.
I think that's within Sacramento County. So I applied to every single one of them,
Mm-hmm.
and I didn't get in for a couple of times. And some schools, they only accept once a year. So that's a challenge. So
Wow.
if you don't get in once, you just don't get in at all for the whole year.
So you have to wait till. So what do you do?
The hardest, see, the thing is, at that moment when I was still applying, it was all lottery system. So if you're a 4.0 student, if you speak a different language, if you have prior military experience, if you have any other degrees, you're still in that whole lottery system. I think I can't be sure, but I think they're switching it a little bit to merit-based. So I think if you have any of those qualifications, you get extra points. You have more chances of getting in.
That's awesome. That makes
Yeah,
sense.
and I think if you're applying second or third time, they kind of throw your name to the hat like more than once or twice.
I mean, can you imagine a guy maybe serving in the military crazy trauma experience, and somebody
And he
else
can't
that
get
has
in.
no experience gets a job over him.
Yep.
That's crazy.
Yep. So whoever's a B student
Yeah.
gets in before the A student and the
Yeah.
one who has experience. So I couldn't get in for a couple of times.
Mhm.
And so I applied to Delta College. It's in
Mhm.
Stockton. So it's quite a ways away. So I think from Sacramento, it took me about 2 hours each way every single time we drove.
Mhm.
So that was a big time constraint because a lot of clinicals that you do, they're like 10-hour shifts, 12-hour shift, plus 2 hours each way. So you're looking at 16-hour days. So you
Man.
come home, like you leave at 4 o'clock in the morning, you come
Yeah.
back, it's already 8 p.m. And then the next 4 o'clock,
Yeah.
you got to go in again.
How long did that go on for?
So that's 2 years. So the program itself is 2 years. So I
Yeah.
applied everywhere that I thought I could get in. I even applied to, there's a private school in Napa.
Mhm.
I think it's a 7-day Adventist school, if I'm not
Mhm.
mistaken. So I even applied over there. I could not get in. So I
Wow.
applied to Delta College, and luckily, I was on a wait list. So for anyone who actually is on a wait list, do not get discouraged.
Mhm.
You can still get in. I think I was number 9, and they
Yeah.
still called me. I think
Wow.
the school already started. They're like, "Hey, are you still interested?" I'm like, "Yes,
Yeah.
yes, I am."
I've been waiting for
By
so
all
long.
means, I've been waiting for so long.
Yeah.
And I encourage everybody to apply elsewhere as well because Sacramento is so impacted. I think when I was looking at statistics, I think out of 1,500 students that applied that 1 year, they only took in 45. So you have
Wow.
1,500 people apply for 45 positions.
Yeah.
So you can kind of calculate your chances.
Yeah.
In Delta College in Stockton, when I applied, they had 70 openings and they had only 500 applicants. So your
wow.
chances of getting in
Much
are
greater. Double.
triple. Yeah,
Yeah.
more than tripled.
Yeah.
So I got into Delta College. You just don't be. I just say don't be picky. You get in where you can, and then later on, once you finish your nursing school,
Mhm.
you take your boards exam. It's called NCLEX. It's a
Mhm.
state licensing exam.
Mhm.
Once you do that, and that itself is a very challenging test. I don't know if you're familiar with it at all.
I'm not.
So it's a smart test. It's a computerized test. So it kind of goes on based on how you're answering the question. So it starts off with a fairly easy question.
Mhm.
So let's say you get it right, which you don't know if you do or you don't.
Mhm.
So let's say you get it right, it gives you a little bit more challenging question. As soon as you get that one right, it gives you an even more challenging question. If you get that one wrong, it bumps you down to easier question. So it kind of goes on a scale. So some people, it just depends on how well you do. As soon as you hit that mark, whatever the mark is, the computer will shut off. And hopefully you pass. For some people, it can close on, for me, I think it closed down on 79th question. Some people I know that had to go through all like 300 something questions. And it's torturous. It's like a couple hours long and it's super,
Man.
super long.
So
And they still
I'm guessing
passed.
you're a pretty smart guy if you went only 79.
No, I mean, I just hit that mark, whatever the mark needs to be.
Yeah.
It's very stressful. The test itself is,
How long? Okay, so how long did you study for the test?
a lot of people, they wait after, as soon as they finish the program, they wait to maybe study up, maybe take a couple courses. I took 2 prep classes after graduating. One was called ATI, and that one was provided by the school. And the second one I did Kaplan, and that one was like $400. It's a prep class, which I didn't really find it that useful. I really like the ATI one. So for anybody prepping for the NCLEX, I look into ATI.
That's
It's
some
a really,
useful
really,
information
really,
right there. So how can whoever's looking to become a nurse, how can they prepare themselves in high school? Can they prepare themselves in high school? Or just getting out of school? What's the best type of volunteering to do and stuff like that?
So the way I started is I started to volunteer at UC Davis. There's a lot of hospitals where you can do volunteering. Sutter Roseville does. They do have a volunteering program where we have a lot of volunteers. It's pretty much, I always encourage the high schoolers to go into that route because they can kind of feel to see if this is something for them or not. If they feel like it's very stressful, it's a very high paced environment, this is just not for them. they can kind of get a sense for it. But I just say don't make your judgment too early. I say really give it a try. Um, for instance, when I was in nursing school, it just really depends on who your professor is.
Mm-hmm.
Sometimes you feel very encouraged, like, okay, this is going to be my career. I'm going to do so well.
Yeah,
Some
yeah,
professors just make your experience not really that great. So then
yeah.
you start to second question yourself.
Okay.
So all the nursing students actually go through our hospitals. I think we're contracted with 2 or 3 different schools. I always say, you know what? No matter how hard your school is,
Mm-hmm.
just get through the school. You might not really like the school, but the real life experience, real life world stuff,
The
it's
hands-on
just
part.
so much more
Do you
interesting.
get to do when you're in school? Do you get to do the hands-on
You do.
stuff? Okay.
Yeah.
Okay.
You do with the supervision of a nurse
Okay.
or a clinical instructor. So pretty
Okay.
much.
That probably
But
helps to motivate, some students.
absolutely, yeah. You still get to assess your patients. You
Mm-hmm.
still get to chart into the system. You still get to give medication. You still get to talk to people. You still gotta. You pretty much do everything the nurse is doing, but
Mm-hmm.
you're still in training. So you pretty much get to have somebody looking over for you, make sure you don't make a mistake.
How early into nursing school are you able to do this?
Uh,
Is that
First
like
semester, right away. I
really?
think the first semester we started off in the lab, so we were practicing on mannequins.
Mm-hmm.
So assessing wise, nowadays nursing school is just very sophisticated. Like they have these mannequins, they're kind of like a real person. They
Mm-hmm.
have a heartbeat that you can listen to their lungs, they can respond to you.
Mm-hmm.
It's just a real life scenarios, which is really, really, really cool.
That's
So
awesome.
I think the first couple of weeks we started off with mannequins,
Mm-hmm.
and then we started being introduced to patients. Like the first couple of months, we didn't really get a chance to really work with the patients directly, but
Mm-hmm.
more of a indirectly, like prepping, go doing paperwork and stuff like that.
Okay.
Maybe looking up through their chart, maybe learning about different diseases to see why this patient has this, and kind of anticipating if this patient has this, what possibly can the doctor order for it. So kind of start making your brain work a little bit.
Okay.
Uh, by the end of the first semester, then you're introduced to the patient care that you get to really work with patients. And the more you're into school by second, third semester,
Mm-hmm.
the more things you're allowed to do. I think by fourth semester, we were putting in IVs, we were putting down tubes
Okay.
through the different ways. And yeah, it was pretty much
Okay.
you're really, really
That,
independent.
that's awesome. So, did you have ROP in your high school?
I did.
What high school did you go to?
Mariloma.
Mariloma.
I went to Mariloma, but I did not do ROP. So when I thought I was going to be a firefighter,
Mm-hmm.
and that's the first path I wanted to go to, I started taking EMT class. So
Okay.
the RP is such a diverse thing. You can go into medical assistant, you can try it out. There's EMT. I think there's like a whole bunch of other ones. Well, I've always been interested in
Mm-hmm.
medical care.
Mm-hmm.
So I've never really looked into other ones. But I
Okay.
say start out with an RP, start out
So
volunteering.
if your high, I'm gonna interrupt. If your high school doesn't have an RP and you're a high school student, are there opportunities like that you can sign up for yourself? Do you know of any? Have you heard of any?
I don't know.
Okay.
I'm not really sure. But you can always go volunteering on your own.
Okay. Right.
You don't need you don't need a referral from your school.
Mm-hmm.
Like I did. I think I volunteered for just a few months,
Mm-hmm.
and it was in UC Davis. My main goal of volunteering because I thought I was gonna get in with UC Davis. So
Okay.
that was kind of like I thought I was gonna get in, kind of maybe get introduced a little bit,
Mm-hmm.
get a feel for the floor, maybe get to know some people, some managers,
Mm-hmm.
and kind of pick their brains to see how the hiring process works, to kind of
Mm-hmm.
look ahead. If I do go through nursing school, once I finish nursing school, what are my perspectives of getting a job? Because
Mm-hmm.
that is the ultimate goal as well.
Okay. Um. Any any other suggestions maybe that you had that things that you would have maybe changed or done differently, in schooling or getting prepped for schooling, for the nursing school, like applying suggestions for any of the students. I mean, I know there's a bunch of people out there looking for, to talk to maybe a nurse or somebody. They want to ask them questions. Does anything come to mind?
With schooling, I would probably say always aim for bachelors.
Okay.
5 years ago when I applied, it was not a strict requirement just yet at that point.
Mm-hmm.
But when I applied, when I was on this interview panel, one of my directors, she pretty much said, you are hired, but with the condition that you will get your bachelor's within the next certain X years. So I say most of the nurses coming in, they do have a bachelor's degree. You can
Mm-hmm.
still get hired, I think, within Sutter system as a ADN, which
Mm-hmm.
is associate's degree nurse
Mm-hmm.
with the
Mm-hmm.
nursing license. But I always say make sure you pursue bachelor's because that is starting to be the minimum requirement. If I'm not mistaken, I think UC Davis won't even look at you if you don't have a bachelor's degree. And if I
Wow,
can't be sure about Kaiser,
that's
but
discrimination.
no, I
Um,
mean, see, the thing is, like, they value higher level of education,
yeah, it
and
makes
that should
sense.
be the minimum standard.
Yeah, it makes sense. You
So
want to
I
be the
always say,
you want to have
yeah,
the best.
yeah. And see, the thing is, like, if you don't get into Sac State or any state university right away after you take your prerequisites or something like that, you can always go the way I did. I went to associate school, I
Mm-hmm.
got my ADN, then I went to Sac State. There's a bridge program, what they call it. It's
Mm-hmm.
like it's a full time school. I think it's like 18 units a semester,
Mm-hmm.
or you can do it over a year and a half, and it's like a 12 units. So it just depends how fast you want to finish it.
Mm-hmm.
But with possibly within a year, you can go from your ADN license to straight to bachelor's.
So
Sac State.
once you have a job, how do you have the time to go back to school and get your bachelor's
You
degree?
work night shift, and as soon as you clock out, you go to Sac State and you do your 18
Oh
units.
my goodness, that's crazy. That's
You can space it out, but the thing
yeah.
is, obviously, the longer you space out, the more
The longer it's gonna take.
and the more money you're gonna spend because each semester you have to spend, it's a
Certain amount of
unit.
money.
Yeah,
That makes
units cost
sense, I guess.
money.
I mean, if you're, you just got to be motivated, man. You just got to be motivated to do it. Whatever you want to do, set your mind to it, and know the end goal. And I hope, to anybody listening, Oleg, I hope this hasn't been discouraging. I think they knew if somebody wanted to become a nurse, I think they knew that this is going to be a tough road ahead of them, and they're going to have to fight for every test, for every class that they want to get in. Because, like you said, 45 open positions, 1,500 people applying, are some crazy numbers. Um,
You mentioned about hiring.
yeah.
Yeah, so I don't know if a lot of people know, but especially within the Sutter system, there's a program called RN Strong,
Mm-hmm.
and they can just Google that, go to sutterhealth.org, and they
Mm-hmm.
can view that. It's a phenomenal kind of. As soon as you graduate,
Mm-hmm.
you get in under their. I think it's a year of I don't know how to explain it even. So you get hired on to a different unit, let's say med surg
Mm-hmm.
floor
Mm-hmm.
or telemetry or ICU or whatever it is, right?
Mm-hmm.
And if you get in through their program, it's also an extra hands-on. They give you extra class time as well.
Mm-hmm.
So they go over the things they went over in nursing school. So they go over blood transfusion, maybe different drips, like a heparin drip, PCAs,
Mm-hmm.
different kind of feedings that maybe you have to do through a tube and stuff like that. So it's more of a hands-on, which is so awesome, especially for a new grad nurse,
Mm-hmm.
because it's one thing you learn it in school, but
Mm-hmm.
once you graduate, once you actually hit the real life world stuff, it's a lot of things are different.
It helps out.
It helps out so much because, and so you still you still work, you still got your benefits, you still got your position, you got your full-time or part-time, whatever you got hired
Mm-hmm.
on, and you have the extra resource, so you can actually go to these classes. You have these preceptorship, they can answer any questions that you might have. So it's so awesome for any new grad nurse,
That
especially as a
that
new
is.
grad. It is so stressful the first couple of months
Mm-hmm.
before you kind of get kind of in the flow. Maybe by the time you get comfortable with the job.
Okay.
So I definitely say look into it for anybody
That
who's interested.
that's awesome. I have another question. I know you work night shift, so maybe you don't deal with patients' family members as much, but what can family members do better to help you out? And I know you've probably experienced agitated family members that are giving you a hard time. What can we do better to help a nurse out? And then what are we doing right? Maybe by asking the correct questions and stuff like that.
I say one of the first things I would say to a family member is just trust the system. No, truly though,
Okay.
because we have phenomenal group of doctors. Our
Okay.
doctors are incredible. The
Okay.
nurses, we know what we're doing,
Okay.
and we've been doing this for quite a long time. See, the thing is, we also have to understand that a family member might not know so much about the disease process or what's going on with the family member.
Yeah.
Or we just had a patient recently that was almost on the end of their life, and the
Mm-hmm.
family member just didn't really know how to cope with it. So they they were lashing out. They're making they just didn't know how to cope with it. They were angry, they were anxious, they just didn't know what to say. Things.
They expected something just to come down and take all the issues
Yeah.
away. And
So I say for a family member, what we do is we like to just take a couple of minutes. It
mm-hmm.
doesn't have to be a 20-minute talk. I like to just pull up a chair next to a bed, just sit down and just kind of talk about it. This is what's going on. This
Mm-hmm.
is what's happening with your loved one, mom, dad, brother, sister, whatever. This is what the doctor ordered. This is the plan. This is why we're doing it.
Mm-hmm.
Explain the why, which is very important. And just kind of sit and talk to them. Ask them what their fears are. And
Mm-hmm.
sometimes, a lot of times, what we find helpful is just to ask and just kind of listen back to what they got to say. Because a lot of times their complaint is not really a complaint. They just need to talk it out.
They
So
just don't know the
they
answers.
just don't know. Yeah. So if you kind of break it down to see what it is, what is this disease, what it does to your body, why your loved one is feeling the way it's feeling like, but what we're doing about it. So what's going to be the next step? And the beauty of kind of department that I work with is
Mm-hmm.
that we see when the patients just come in, as soon as they get admitted, they're hurting, they're uncomfortable, they just got their diagnosis of whatever it is,
Mm-hmm. Mm-hmm.
and we get to follow them for all their length of stay. For the next day when we're on, we can see like, okay, so you have an issue with your stomach. Okay, you had a tube and you have a bowel obstruction. Your stomach is not moving. This is
Mm-hmm.
why, because things are not going through. This is what we're doing. So there's a tube that's suctioning all the gunk and all the stomach material out.
Gotcha.
So, but the next time, we're reassessing, be like, oh, okay, so yesterday you had this, but now we're listening to your stomach. Your stomach's starting to wake up. So this is the plan. So now we're gonna pull the tube. Now we're maybe gonna start to introduce you like maybe a little bit sips of water to see if your stomach's gonna tolerate it. So I just say just educate. A lot of things is we educate the family members. Family members educate us because there's a lot of things, maybe the patient's history that we don't know, that it's really useful for us to properly care for the
Okay,
patient.
so sometimes family members are agitated because something's taking too long, or say you're my nurse and you told me this was gonna happen in 20 minutes, and now we've been waiting for an hour. What are some of the holdups in the system that patients maybe don't realize that there are?
So it depends what hospital you work with. We work for a level 2 trauma hospital.
Mm-hmm.
So it just depends. A lot of times, unfortunately, a lot of times if there's a surgery needs to be scheduled and it has been scheduled because of a trauma that comes in, or let's say the helicopter brings something really, really, really urgent. And I believe actually Sutter Roseville is the only trauma hospital in the whole Placer County. So anything that's really, really bad and broken, we're the ones who get it.
Wow.
So a lot of times the surgeon who's supposed to do that procedure on your foot
Mm-hmm.
might unfortunately
Have to
bump your
reschedule.
surgery, or reschedule your surgery to later on that evening, maybe reschedule it for the next day, because right now this is the priority and this patient is potentially might die if we don't attend to them first.
Which makes
So,
sense.
yeah, I think most of the family members, they will understand if you actually tell them what's going on, not just say, okay, I'm sorry, you're rescheduled.
Is a nurse allowed to tell the family like what's actually going on to kind of to calm them down?
In a general terms, yes.
Okay.
Yeah.
No, nothing specific.
We don't go into details,
Yeah.
but we just we talk about it. We talk to the doctor first, and the
Mhm.
doctor will tell us he's not able to do it because of this reason. So this is something that a lot of times we would pass on to the family members, but also a lot of times our doctors would communicate to the family as
Okay.
well. And a lot of times when the doctor talks to the family directly, and that brings
Okay.
more peace to them. Yeah,
Awesome.
they would
awesome.
understand more. Yeah.
Awesome. Honestly, just like with the last nurse, Oleg, I want to say thank you for being a nurse. It sounds like you love your job. You love taking care of people, and as a patient, maybe in the future, hopefully never. But it's nice to know that there's nurses out there, that actually care for their patients. They want them to do well. It's just nice to know that there's somebody out there doing their job because they love it. Not for the money like we talked, but that you're gonna get taken care of. So thank you for doing that. Thank you for coming on.
Thanks for having
Um,
me.
Dude, it's a pleasure. Maybe one day you'll become a nursing manager, or I don't know, move up in the world. We'll get another interview out of you, and you can share some more insights. Maybe how to grow as a nurse in the hospital administration side, because I know there's a lot of things that we don't know about the administration side in the hospital. Anyways, if you guys love this, like this, please like it, share it, subscribe to our channels. We will be posting more content. If you guys have questions specifically for Oleg, comment them down below. If you have general questions for our channel, please let us know as well. And have a good one, man. Thank you.
Thank you.